Hey guys, it's Dr. Jamin Brahmbhatt here with Man Talk. And do you ever as a guy feel like you're all alone in the stands? Well, here at Man Talk, we're hoping to change that. Today, we're gonna have Orlando Health psychiatrist, Dr. Tait, discussing with us mental health issues. Today, I'm actually excited to be here with a woman who is one of our psychiatrists here at Orlando Health, and she is Dr. Tait. And Dr. Tait and I will be talking today about something that most of us dudes don't really like talking about, which is our mental health issues. Dr. Tait, welcome to the show.
Thank you so much for having me.
So if a guy like me were to come see you, can you tell us like what the process would be like?
Absolutely, it's very relaxed, it's very laid back, okay? I actually get to know my clients, so I ask about, your history, your family life, your kids, your goals, your dreams, your job, and then we talk about depression, we talk about anxiety.
And when it comes to depression, really quickly, like what are all the things that you usually offer beyond just medications?
I offer a multitude of treatment modalities. For example, yes, we have antidepressants and common medications that we use for depression, but there are other treatment modalities. So, for example, some clients don't want to use medication, or they've used medication in the past and they've had side effects. So we have technology such as transcranial magnetic stimulation, TMS, Spravato, which is the intranasal ketamine.
So depression is huge?
Absolutely.
Depression, I've heard, also leads to suicide as well. I heard and read a lot of statistics on suicide and how it's more prevalent in men. Is that true in coming from you as an expert?
While depression is more commonly diagnosed in women, okay, men have a 4 times risk factor for suicide over women. So what does that tell us? It tells us that men suffer from depression, it's just not getting reported or they're not seeking treatment. Men experience depression in a more of a external way, okay? So they're coming to see me because they feel more irritable, or they're a little bit more angry, or they're not sleeping.
So if there's a guy thinking about committing suicide, well, what's the fastest way that he can get some help?
Well, you can call 911, any emergency service, go to the nearest ER. There are also 1-800-suicide hotlines that you can call and you can get assistance right away.
So the conversation here is called Man Talk, and obviously men don't talk as much as they should. Once they finish watching this segment, what are some things that men or their loved ones can do to get kind of guys talking?
Number one, bringing awareness, okay, that men do suffer from mental conditions, mental illness, okay, and it's something that we need to talk about with our friends, talk about with our families. Even if we're not feeling depressed or anxious or what have you, they may be, okay? And so coming from a place where you can be open and honest and be vulnerable with your friends and family, I think that's a good first step. The other is seeking treatment, okay? So there are mental health professionals here ready to help you.
Dr. Tait, thank you so much for joining us on this very inspiring conversation. So hopefully we've been able to get guys to talk and really just get them to live healthier lives. So thank you, Dr. Tait. You were awesome. Hey guys, as you heard with our conversation with Dr. Tait today, there should be no stigma to your ability to have conversations with others about your mental health issues. This is Dr. Jamin Brahmbhatt with Orlando Health. This is Man Talk. Be well.